Welcome to the practice managers meeting. I have already asked, but if you are just joining, please go ahead and add your name and your practice to the chat so that we can make sure that we have you for attendance. Like I mentioned, we have a very full agenda, so we're going to go ahead and get started here. We're going to do a little bit about staff updates. We have Kelly Featherly, and Renee, if you want to just peek in to see if Kelly's joined yet, who's going to talk a little bit about the ePartner Refuel project. Renee is going to give us a nice overview, very brief, of the 22 PCP reward plan payment. And then we're going to talk about some Bright Futures and Meta user group things coming out of optimization. I'm going to do a review. And then Elizabeth's actually going to keep talking about the new provider engagement report functionalities that we have. And then I'll do a review of our provider notification process for individuals joining and leaving practices. And then a very, very quick update on the Vatico Well 365 program. So to kick us off, we have some new team members who you guys will come to know or will begin to know very soon if you have not met them or been introduced virtually yet. The first of which is Angelique Cohen, who's going to be joining us on October 1st as our Executive Medical Director. We're very excited to have Angelique joining the team. And so you will see her pop up when she joins us on the 1st. We also have Lindsay Bushnell and Shanika Flowers-Bruley, who joined the pediatric social work care management teams in the last couple of weeks. So Robin has already done outreach to the practices they'll be working with, but these are new faces around HP that you will be seeing. On the flip side of that, we have some notable departures, one of which is Renee Sutton, who will be leaving AHP on October 13th. And we are sad to see her go, but really happy for her future endeavors. So just so you are aware of that transition. Lynn Hefferin on the pediatric social work care management team has also decided to retire. So she will be departing AHP for a long retirement on October 6th. We also will be saying goodbye to Christopher Foote, who joined the social work the RN care management team and will be leaving next Friday, September 29th. So for all of you, this is your time to, say your party goodbyes and offer that. Now I am actually going to stop sharing because I believe Renee is going to run her slides, but we will have a quick overview of the 2022 PCP reward plan because I didn't get a note about Kelly Featherly being present.
Kelly, I think is on her way.
Yeah.
Zoom room mix up there. And she's coming in shortly. I think it's only.
I'm actually here.
Hi, Kelly. Sorry about that.
That's okay.
Since you're here, we'll definitely let you go first. But before we turn it over to Kelly, Jana made that announcement about my departure from AHP effective October 13th. And I would like the honor and privilege of announcing that succeeding me in the role of Director of Provider Network Management and Payer Relations will be Jana Darlington. So you will have a familiar face remaining in the seat. We're so happy. The whole team is. I'm also particularly happy to have Jana take on this role for which she is more than experienced, educated, prepared, all of those great things. And I know that everyone will have as much fun working with her as I have had. So I know I'll give her your support and your help, and she'll be there just as AHP has always been with to support you similarly in any way that we can. So with that, I want to turn it over to Kelly Featherly, and she's going to present to you on ePartner today, right? That's ePartner. Okay. Welcome, Kelly.
Thank you so much. Yes, I am not muted. Okay. So yeah, we worked earlier this year on a refuel project for ePartner where we had a pilot group that went through and we gave them access to be able to order labs, radiology, cardiology, and also order for referrals with our specialist at URMC. And that went very well. All of those things are working and up and running, and the clinics that are live with it really are enjoying it. having that ability to just put it in electronically and not fax a paper and then wait for someone to get the paper and enter the order for them into the system. It falls right into our normal workflows within eRecord at URMC. So it looks like it's from an outside group, but it falls in line with if it had been referred to by an internal provider. So, which makes it nice and easy for our staff to just kind of flow the patient into their normal workflows. So the pilot's complete, and we're starting to give that feature to everyone. We do have a few other projects happening within this particular team from now until the end of the year. So what we're doing, if there's new practices that want ePartner, we're giving them the new functionality. And for those that are already on ePartner that don't have the new functionality, if they reach out to us, we will definitely work with them to get the new functionality added to them, to their site. So we're kind of doing it as people ask for it. So if anyone's interested, or you know of groups that would be interested in being able to order directly in ePartner instead of faxing things over to URMC practices, we can definitely get you in the queue and get you going on that. We're hoping early next year that we will work on doing a rollout. So everyone that already has ePartner will start rolling out and working with each group to get them up and running. It would be great if we could just flip a switch and turn it on for everyone, but unfortunately we need to know, like, in the system, who's a provider, who's a nurse, who's a front desk staff person, because you all get a little different security. So there's some things that we need to actually roll it out to everyone. So that's why it takes a little time to get each practice up and running. But we do have a flyer that we can send out if anyone's interested to just kind of learn a little bit more about ePartner if they don't have it now, and what you can do with it. So also later this year, early next year, we're working to move ePartner off of Citrix, which means you would no longer need AD accounts at URMC. You'd be able to log in with a different username and password. You wouldn't have to VPN into our systems. You wouldn't have to, again, have that AD account, and you'll be able to request new staff to be added or for staff to be taken off your list when they leave. Much easier right through ePartner. So it's all in one system and much faster and easier for everybody. So we're hoping that'll be early next year that we'll get all of that up and running. So you'll be seeing some changes still throughout the next, 3 to 6 months for sure. So, any questions or any thoughts about ePartner?
I had a question for you, Kelly. When you no longer need Citrix, you no longer need an Active Directory account, will folks that have guest accounts, in order to use eRecord, will those guest accounts be automatically terminated?
If you are using it for eRecord, you will keep your guest account for the eRecord pieces. So they will not be terminated. We'll go through and try to carefully do that so we don't term people that we're not supposed to. We might miss some people and term it on accident, but we'll have people available to get you back in quickly.
Yeah. Any other questions for Kelly? And Kelly, if folks want to, go ahead. Oh.
What email should we send the request over to for the new functionality request?
Yep, you can either call our help desk at 585-275-3200, or you can email epartner@urmc.rochester.edu. So it's at the bottom of this flyer here, which I could send this flyer out to everybody. So you can have this information at your hands. So
you send that over to us, Kelly, we can get it out to the full group.
Okay, great. Thank you.
Any other questions for Kelly? How's it going, Kelly? Are you getting a lot of uptake? Are community practices signing up?
Yeah, I think people that know about it are interested and excited for it. So it's been going well. Yes.
Thank you.
Right.
All right. If there are no other questions for Kelly, these payments were pushed out to providers around August 29th and 30th for community PCPs. We made electronic payments. And for the remaining providers, they were paid around September 14th and 15th. Paper checks were issued to them. I'll stop there for questions. I see is there some stuff in the chat? No, okay. Any questions? I know
Hi,
that
good
was,
morning.
oh, no, please go
Hi.
ahead.
Yep. Can you speak a little more to the relationship with Arcadia and if that will be continuing for the foreseeable future?
Sure. So I think the buzz is out on the street that AHP is shopping for a new population health system vendor, and we're close to a decision on that point. Arcadia remains, however, the choice at present of our aqua partner, Excellis. So, that is how we are contractually obligated to report on our quality to Excellis. So at present, while we're pursuing a new population health vendor, and we believe Excellis is also, perhaps talking to other vendors, we want to move to a new population health vendor that'll help AHP more effectively manage cost and manage quality. But Arcadia may still be in the picture until such time as our aqua partners make another choice of partner. Did that answer your question, Ross?
It did. Thank you very much.
You're welcome. Anyone else, any AHP folks care to additionally characterize my response, or did that do it well enough?
No, I think you've nailed it, Renee. I think that's really the situation. Appreciate the question, and we'll probably have more to say on this soon.
Thanks, Mark. If there's no other questions on Gainshare before we move on, and there'll be more of this in additional presentations during our time together, is that now we're in 2023 and we're under the 2023 PCP reward plan. And we're not holding providers harmless this year. You've got access into your quality performance into Arcadia. The provider engagement report is available and there for you to log in and see how you're performing to those other components of the plan. Arcadia is your source of how you're doing for your quality measure performance, and that is important as we discussed. That's the biggest piece of the pie when it comes to your incentive. It's the biggest chunk of the incentive. But the remaining components, LARC, pharmacy, citizenship, and depression screening, the only place you're going to see your performance for those elements is going to be in the provider engagement report, and it's going to show you how you're doing, and it's going to give you visibility into where your gaps are, and it's going to be actionable data for you to follow up on and truly optimize your performance. So I encourage everyone, if you're not already logging into Arcadia, if you don't have access to the PER, you don't look at it regularly, to please do so. So in the spirit of 7 ways, 7 times, or sorry, Mark, I'm butchering your saying. You're going to hear
8 ways.
Okay, thank you. You're going to be
7 works too.
Pardon me?
But 7 works well also.
Okay, thank you. So you're going to hear that drumbeat throughout these presentations of us encouraging you to keep looking at. That's how you're going to optimize your performance and optimize your incentive capture for the PCP reward plan in 23. And we are working on defining what the 2024 PCP reward plan is. So you'll be hearing more about that in the coming months as well. So with that, I will stop talking.
Thank you. Kevin is going to talk to us briefly now about Bright Futures Access.
Thanks, Jana. Good morning, everyone. Yeah, quick announcement. A lot of providers already took advantage of this Bright Futures Access. A lot of people, I've made a few announcements in the network news, Quality Corner, and presented in last week's pediatric PCP advisory meeting. Just letting everyone know, the Bright Futures Toolkit and Resource Kit is available. We purchased it for the whole network, so there is institutional login access, and I even had a provider let me know that they were in the middle of negotiating a new contract with AAP. So just in time, I will let them know that, we purchased the Bright Futures Toolkit and no need to negotiate further. So that was encouraging and exciting for them. But AHP promotes evidence-based approaches to comprehensive developmental screening, and that's why we purchased the Bright Futures Toolkit. In the Bright Futures Toolkit, there's pre-visit questionnaires, visit documentation forms, and parent handouts, as well as age-specific resources for preventive health screening, infants, children, and adolescents ages 0 to 21 years. If you're interested, if your practice is interested, excuse me, I'll put my email in the chat, or if anyone has any questions regarding comprehensive developmental screening support, I'll be reaching out in October for those interested in engaging in CDS. So please feel free to reach out, and I'll put my email in the chat. If there's any questions, please reach out.
Kevin, are we providing access only to community private practices, or are some of our hospital employed, like Thompson employed or Finger Lakes Health employed, can we provide access to them as well?
Absolutely. Actually, the medical director at Thompson was the one I was referring to as they were negotiating contracts. So that was really exciting. So yes, we are providing to the hospital and larger system. I'll put my email in the chat. Thanks, Jana.
Thank you. Renee did drop it into the chat as well, but I'll say it now for effect. If you are just recently joining the meeting, please enter your name and your practice location in the chat so that we have that for attendance. And then I'm going to kick it over to Elizabeth, who's going to talk about Medent user group and also some of the new PER functionality. So you'll get to see the provider engagement reports new functionality.
Hey, before you start that, I'm going to throw in a plug. If you wonder why we're kind of in your grill about put your name in the chat, it's because your attendance here helps satisfy your provider citizenship incentive component. And as we were just running the numbers, so many of your attendance here, your work and your effort as part of your team, so many of our providers have that citizenship component satisfied by virtue of your attendance at this meeting. So, why waste it? You're here anyway. We want to know about it. Please put your name in the chat. So that's the reason why we're obsessed with it.
Yes. Not just because we, want to know who you are, but there's good reason behind it.
And then all the AHP people put our name in the chat because Jana and Renee tell us to. Okay, I'm going to jump in. Thank you, everyone. Let me share my screen really quickly. I have a couple topics, there we go, to cover today. The first one, and I'm aware that not everyone on this meeting is a Medent user, but AHP has been working for actual years on the idea of a Medent user group. We know that sometimes with all of the EMR partners, it can be challenging to share best practices. We didn't currently have a way to facilitate, the sharing of information between our practices, not just about the functionality of the system, but about how best to leverage it, how best to use it. That being said, the idea of another meeting is a bit of a non-starter these days for folks. And so we've created what we're referring to as our asynchronous Medent user group. It's a learning opportunity for our Medent practices. We met with a number of our practices, and based on feedback from them, kind of started out with the topic of the patient portal. So we partnered with Medent around this topic, particularly the authorized representative. So we have a number of our Medent practices are in the pediatric space. The authorized representative is the terminology that Medent uses to indicate anybody who isn't the patient. So most commonly the parent of a child who might want portal access. It could also be adults caring for their parents, somebody caring for someone else, anybody who needs access to that portal who isn't the patient. Medent does recommend using this authorized representative when logging in if you are not the patient. So we partnered with Medent. We created a whole bunch of material. You can see here the table of contents for the kind of suite of things that we've pulled together. There's a number of different ways to digest the information they're sharing. So infographics, videos, screenshots, information how to set this up and when to use it, and information on consent, which is a large part of why the authorized representative is so important to our practices. Right now, I'm just going to keep kind of scrolling through and show you some of the stuff. The authorized representative and the patient access are independent of one another. So you could set up an authorized representative login to the Medent patient portal without having a patient login to the patient portal, which comes in handy when your patient is a newborn. Right now, the access is completely the same. Eventually, we hope that Medent will be able to offer some sort of tiered access for patient privacy, particularly for those adolescent patients. I will note oh, I'm like pointing at my screen like you guys can see this, but the email activation feature is available in Medent. So in order to have the email activation for the authorized representative, you just need to have the most recent update taken. So again, just highlighting the information that's available. This is supported in the Medent manual. We have some patient handouts so patients can understand. We've got some videos. They do have step-by-step instructions and video tutorials for how to use this feature, and then the Medent infographic. More to come on this. We're going to be putting this up on the AHP website, but we just wanted folks to know that this is going to be available. We've had a really nice partnership with Medent around this topic. And around the idea of standing up this user group. So we are also hoping to be able to incorporate more information and potentially help drive the Medent roadmap in terms of what is a high priority to our practices. So if you have a question, if you're a Medent user and you have a question about how to use your EMR or something that was hard to figure out, we would love to hear about it as additional topics that we can possibly explore. I'm going to pause for a moment there. Does anybody have any questions about the Medent user group? Okay, I counted to 5 because that's what LJ always says I'm supposed to do. It's really hard. With that, I'm going to jump into the provider engagement report. So I know Renee had mentioned this. I wanted to take a quick peek with folks and talk about some of the new functionality that's available, new things you can see. I did do screenshots because I wanted to show you some internal medicine providers at the provider level and some pediatric information at the provider level. And it seems sort of rude to out particular providers in the midst of a call with all of our practice managers. So brief reminder, this is the 2023 homepage. When you log in, if you're looking at your population, I applied basically no filters here. You're going to see these different cards. What I wanted to talk about today is what happens when you filter down to a provider. So if I choose a single internal medicine provider, you can see the cards populate, and so you can see more information. The quality measure information is still going to be in Arcadia. So that's still going to be where you need to log in to see kind of how you're doing there. From a citizenship perspective, I'm going to log into these or click through to these in just a moment. But from a citizen perspective, you can see whether your practice is meeting this, and if the practice is meeting this measure. So every single provider would be checking that box. The circle on the left would have a green color in it. And if the practice is not meeting it, we're offering the providers the opportunity to meet that citizenship component. And again, we're looking for the green color. For depression screen and follow-up, you can see very basic information here, you know, the patient population, how many have been screened and what the target is for the year. And then again, you can click through to the screen. Similarly for pharmacy, you can see the 4 pharmacy initiatives that we have, whether or not they have been met. If they're an open circle, there's still work to do. If it's filled in green, then we're looking good. And this particular provider did not have any LARC opportunity. So sort of switching gears to take a peek at the pediatrician view. Oh, and I forgot to call out at the top, the provider rewards. You can see the % of total rewards earned. So again, quality measures in Arcadia, citizenship, you can see this practice is actually earning. Depression screening follow-up, it is green. So this provider is doing well on their depression screening. We don't have any pharmacy information, but you do have a checkbox for LARC and when that LARC training was completed. So if you were to click through to the citizenship page, this is one of the things I wanted to show. Sorry, this is a little fuzzy. I guess my screenshotting wasn't quite as precise as I wanted. But you can see here the criteria available for meeting the practice requirements and then meeting the provider requirements. Just as a reminder, I know Renee said this, but there's some number of ways that I'm supposed to say it and some number of days. I'm not really sure what that phrase was. I'm sure Mark can weigh in. If 2 criteria on the practice level are met, then every provider in the practice gets the citizenship component. If those are not met, then the provider has the opportunity to meet the 8 times 8 ways, thanks Mark, to meet the measure essentially. And practice managers attending 2 or more practice managers meetings counts. So that's really lovely. Skipping over, this is not new, but you know, I'm always going to pop up the depression screen and follow up. What you have here is a year view of your patient panel, those patients screened and not screened, of those screened who were positive, of those who were positive who had a documented follow-up. With any of these components, you can click on the number and it will give you a patient list on the right-hand side. So happy to come out and talk more. I did not take a screenshot of the pharmacy screen because it has a lot of patient information, but I know Bob Adams and his team is always happy to engage around the pharmacy measures as well. One other thing that I wanted to mention for you all is this provider rewards section. So this is particularly important because it's a way that you can take a look and see how your providers are doing kind of overall at that more administrative level. I have grayed out our names and practice groups, but what you can see here is essentially there would be a PCP name and you can see their total and the components that they qualify for. So this third doc doesn't qualify for LARC. You can see the reward plan, what the different component breakdowns are, how much they have earned, and how much is left remaining. So you can kind of take a look and see how everybody's doing. We don't want there to be any surprises at the end of the year. We want folks to understand how they're performing and what levers they can pull to move the needle there. I'm going to stop sharing for a moment. I tried to do this reasonably quickly and also just highlight what's new and changed and improved. If this looks new to you entirely and you don't want it to, if you want to become more familiar with the provider engagement report, if you have questions, I'm putting my name or my email address in the chat, and I'm more than happy to touch base with anybody on the call and walk you through your own practice. I have always said that I can't learn a system until I'm the one clicking the mouse. And so if anybody else feels that way, more than happy to come out and touch base, review your data with you, see if there are any questions, any concerns, and make sure you're comfortable using the system.
I don't see any questions in the chat, but if you have any, you can drop those in there. I did also want to mention that we, for providers who have LARC in their reward plan, we do have upcoming trainings. So just like last year, Dr. Phelps is going to provide a virtual talk. It's going to be November 9th from 5:30 to 6:45. So it's going to be an hour talk and a 15-minute discussion. And that is one way that you can satisfy the training component for LARC this year. So that's an easy way to do it. It's free for our AHP providers. And so we'll get a note out with a save the date and then registration for that as we get closer. So I just wanted to let you know, we offered it last year. We're going to offer it again this year so that if you missed it, you have that. Similarly, if you already did LARC training, I know Kevin's been working with practices who are interested in getting trained in Nexplanon on placement. So if that's also something that your practice or your providers are interested in, you can, send us a note. Kevin, did you want to say anything about that?
No, all good. Thanks, Jana, for the shout out.
Okay. So I think now it's going to be me talking to you for a while. So I'm going to start sharing my screen again. What we wanted to do is to very briefly talk through when we have providers leaving and, I'm still on that. So talking through when we have providers who are joining or leaving an AHP practice, we throughout the year get information about providers who are leaving, joining, retiring, moving on, and all those things. So we kind of wanted to talk about that process as we're moving into roster submission season, which is how we're driving participation on our value-based contracts, those awful contracts. So the most important thing is to know when providers are leaving your practice. And the general rule of thumb is if you are going to tell the insurer something, whether they're leaving or joining, you should tell AHP as well. For practices who have large provider rosters, we've worked with Cherie Turpin, who's also on the call, has worked with your credentialing offices or your practice managers to set up a process for getting this information on a regular basis. But for the most part, our practices are letting us know on a one-to-one provider basis when someone is leaving or joining. So what we need to know from you is the provider's last day and their future plans. And similar to you dropping your name and your practice in the chat, it's not because we're nosy. It is because where they're going is going to determine how your attribution is treated, and then that will determine how and if we're going to continue to pay clinical integration dollars to your practice, and PCP reward plan incentives and all of those things. So we need to know if they're moving out of the area, if they're retiring, if they're starting their own practice, and if they're joining another practice, and if you know that practice's name. For some reasons, it just helps us with a lot of things. For instance, if we have a provider that's retiring, we assume that the patients aren't going to retire with the provider. They're going to stay at your practice, and that attribution is going to be picked up by other providers at the practice. So we continue to pay, clinical integration dollars for that attribution as they, transition to other practice providers. That is different than if someone is leaving to start their own practice. Now we need to be on the lookout for how those patients are, leaving that practice, joining another practice. And similarly, if someone is leaving an AHP practice to join another AHP practice, that may make a determination on, what happens with their attribution as well. So it's just good for us to have that information at the ready. Then the next part is, someone is joining your practice. Again, let us know as soon as you have a start date, even if it's in the coming months. We won't go through the process of enrolling someone until that date is, has arrived and they have joined the practice. But it's good for us to know so that we can be on alert to reach back out or, say, oh, I know we have this practice coming, this provider coming to the practice. So let's make sure that we don't miss any of the dates. APPs, we need to be alerted of all physicians and APPs joining your practice. And APPs are not formally enrolled in AHP until they have enough attribution to cover the one-time capital contribution of $300. However, they are still participating in AHP. If they are paneling patients and all of those things, we list them on our website. So it's good information for us to have. And if they do begin to panel patients, we're on the lookout for that as well. Physicians and APPs eligible for enrollment have to go through the membership committee and board of managers process to join AHP. And both of those meet 6 times a year. So again, alerting us as soon as means that we can get them on those agendas for approval. Their start dates will be the date that they are approved by the board of managers. But it's just good for us to know. When someone is joining your practice, the information that we need is their first and last name, NPI, their official start date, so when you expect them to start at the practice, and an email address. This is something that we're trying to get a lot better about because, as you know, accepting our emails is a provider level citizenship component, so it's good for us to have that information on hand. Anything else I wanted to say here? I don't think so. Again, some general things to understand about why this is important is we can only add providers to value-based contracts at specific points during the year. So Excellus and Monroe Plan have one start date for a value-based contract. So that's the first of each year. MVP allows us to add providers twice a year. So the first of the year and halfway through the year in July. When we are alerted that a provider is joining your practice is what determines when they will join contracts and therefore when they'll become eligible for the PCP reward plan. It is not the date that they started at your practice. It's when we're alerted and we can get them into the membership, through the membership and board. Providers have to be participating in all contracts to be included in the PCP reward plan. So if someone joins in June and they're eligible for the MVP, contract, but they can't join Excellus until next year will be the year that they are eligible for the PCP. What that looks like, because I thought it was really important to kind of visualize that, is I put this on a calendar year so you can see just what that means. So if we have a provider who we are alerted between January 1st and May 14th that they are joining your practice, they would begin on 7/1 of the current year for the MVP contract, and for Excellus and Monroe Plan, they would begin on 1/1 of the upcoming year. So here, this is the entire Smith family is moving to Rochester, and they're starting at different practices. So we're notified in March that Jane Smith is joining your practice. She would begin. She began 7/1/2023, and then her participation on Excellus and Monroe plans would be 1/1/24. And the first year that she would be eligible to participate in the PCP reward plan would be 1/1/2024. So the 2024 reward plan she would be eligible for. From May 15th to October 15th, anyone who is were notified of their participation or joining your practice from that point, they would be eligible for Excellus, MVP, and Monroe plan beginning of 1/1 of the upcoming year. So let's say on October 1st, you notify us that John is joining your practice. Then he becomes eligible to participate on all contracts the first of the year in 2024 and would be eligible for the 2024 reward plan. What is new for this year is we are establishing a blackout period, which is really going to help us with cleaning up our rosters and making sure everything is consistent. We're not losing people. No one's falling through the cracks. So from October 15th through December 31st, anyone who we are alerted of in that period will begin on MVP contracts beginning 7/1 of the upcoming year, and Excellus and Monroe plan of the 1/1 of the following year. So this is where it gets a little tricky. So let's say Jessie Smith is joining your practice and we're notified of that on the 1st of November. She would begin her participation on the MVP contract for 7/1/2024 and 1/1/2025, and would only be eligible for the PCP reward plan beginning in the 2025 reward plan year. That's why it's critically important that you tell us when you know, because let's say Jessie Smith actually joined your practice in September, but we didn't find out about until November. That doesn't change when she's eligible to join contracts and begin receiving clinical integration for those for her attribution, or when she's going to be eligible for the PCP reward plan in 2025. So we're really trying to get people in the habit of letting us know as soon as possible about providers joining and leaving the practice, because we want to be fair and consistent, and so we really need to know that information as soon as possible. I will pause there for questions because I know this is a different way than we presented this in the past. So I want to pause briefly to give people some questions. Or if there's anything that, Renee, Mark, anyone wants to add to this. No?
I'm glad you went over it, Jana. I think it's important. And we also take accountability to start poking at you before these cutoff dates to ensure we're doing our part to solicit that information out of you. But we want you to be aware of these timelines. I hate to have you miss a whole year's worth of CI or PCP reward plan participation, because of missing a cutoff date on telling us about a new provider.
As always, if you have a question about this, you can definitely reach out to me. You can reach out to Renee while she's still here, while you still got her, to ask any of these questions that you might have. But if there are no other questions, then I'll do a very, very quick update about the Vatico Well 365 program. I know that Renee spoke about this in the June practice managers meeting. So what I'm going to do is talk less about the program and talk more about how we're doing as of today. So again, this is something that also counts for providers who are eligible for Vatica. So not pediatrics, but internal medicine, family medicine, geriatrics, any of those things. If you are eligible for Vatica and you are participating, getting 20% of your targeted Vatica visits for the Excellus Medicare line of business qualifies you for a citizenship component under the PCP reward plan for 2023. So it's available for commercial Medicare and Medicaid, although commercial and Medicaid are not incentivized under a PCP reward plan, can be done on any substantive visit. So physicals, annuals, medication checks, any of those things. And then providers earn an incentive per Vatica visit completed. And if you get that, if you're over 65% of your targeted visits for the year, then on the Excellus line of business, you get a bonus for that. How we're doing as of now. So we've got a 30-day run out or so. So the next numbers I get probably in the next 4 days will get us through the end of August. But right now we're at 30% network penetration. So in previous years around this time, that's pretty consistent. We're usually at somewhere between 30 and 33% on network penetration. And that's specific to the Medicare line of business. So usually we end the year somewhere around 40%-ish. And so I think we're looking good for that. However, I wanted to talk a little bit about the providers who are earning over that 65%. So 60% of all of our participating providers are over the 20% penetration. So you're going to get credit for your Vatica citizenship component if you need that at the provider level. However, only 8% of all of our providers on the Medicare line of business are above that 65% bonus threshold. So as you know, if you're in Vatica, AHP has negotiated a higher incentive rate. So instead of 150 per visit, you get 175. Over 65% penetration, you also get a $50 per visit bonus at the end of the year. So only 8% of individuals, if the year ended today, would be making that bonus. And so we're just trying to work with practices, myself, the Vatica team, to see what are the workflows that we can help you improve to get you above that 65% bonus threshold and improve that performance. Like I mentioned before, commercial and Medicaid is not incentivized in the PCP reward plan this year, but you still have an opportunity again to earn increased incentives. So that bonus is available on all lines of business. It's paid by line of business by provider. So any individual on any individual line of business can earn that 65% bonus. So we really want to make sure that people are optimizing that and being able to earn it. So if you have any questions about Vatica, if you're thinking, oh man, how do I get above that? How do I get above that threshold? What can I do? Are there different workflows? Are there different processes? You can always reach out to me and I can get you connected with the Vatica team. Of course, you can work directly with your Vatica rep and we can get you above that mark. I will also pause for questions there. I don't see any in the chat, but I'm seconds. Before moving on, I do want to open up the floor. We've got exactly 5 minutes left. So if there's anyone from AHP who has anything to share, and I will also read this note from Dr. Shipley in response to Kelly's question, is each provider in the group required to do LARC training? So she says, Kelly, the LARC reproductive health counseling talk is required of each provider for the PER. This is an opportunity to provide up-to-date evidence-based information and counseling approaches to all providers who care for teens and adults. It's a great session, informative, interesting, and valuable. Dr. Phelps is a great teacher and presenter, and we encourage your providers who have not received this brief training to join the chat. So LARC is at the provider level. So this is not a practice component. So every provider who is eligible for LARC in their PCP reward plan has to complete that training individually. So you can see in the PER who has LARC in the reward plan and see if they've completed that component or not. And if you have questions about that, Kelly, send me a note. We can talk.
Jana, can I just add, we're not asking people to repeat that training every year. So if they completed that training recently, that qualifies. If someone has trained recently for Nexplanon placement in their office and have done the LARC training as part of that, that is acceptable as well. We really are just trying to offer this opportunity as much as possible. And we've heard from all of our providers who've attended that it really is valuable. We've heard that from our pediatricians, our family physicians, and our internal medicine colleagues. This really is important for people who care for all adults of childbearing age. So thank you for that.
Of course. Through 2023, Tanya. So the measurement period for LARC training is 1/1/2019 through 12/31/2023. So if any of your providers have attended a training in that measurement period and we have record of that training, they are good through the end of 2023. If you have questions about that, I really would recommend checking the PER because it will show if we have that information. And if you you saying, oh, well, they attended a training. It wasn't the one that we offered last year, but they've attended this training, you can definitely reach out and we can look through on an individual basis to see if what they've attended would satisfy. No problem. Anything else? Okay, I'm gonna get into my last little spiel. Our next meeting is Wednesday, December 13th. It will be again at 8 a.m. and we will do our best to get you out of here in an hour so you can move on with your busy days. We have some upcoming save the dates for AHP clinical grand rounds. We have it October 25th, 2023, 5:30 p.m. to 7 p.m. Again, it will be held virtually. All HP providers will be in attendance for the first, I think it's a 15-minute introduction, and then we will split off into pediatric and adult-focused agendas. This also counts for individual citizenship criteria. So if you're looking at your provider engagement report and you see that some of your providers haven't met the practice level citizenship criteria, this is an opportunity for them to begin satisfying that provider level criteria. We also did a run out and we saw that for over 100 providers, if they attend clinical grand rounds, they will meet and their practice is not already satisfying citizenship. Attending clinical grand rounds will get them over the table for their citizenship component this year. If there's anyone on the group who wants to briefly bring anything up, we have a minute for that. Though I wasn't seeing any questions in the chat, so I will assume there are none. Reminder, yes, you are an AHP practice. For your patients, refer your patients to AHP specialists, hospitals, and send their imaging and labs to AHP Imaging and Labs. This is how those individuals in your contracted health plans will get the best benefits for their insurance. So it is very important that they do that. For your practice, monitor Arcadia and the provider engagement report. We talked a lot about how 2023 accountabilities have been restored. So this is the best way for you to make sure that you're optimizing your practice's incentives and performance. Attend our practice managers meetings like you faithfully do once a quarter. Accept, read, and share our communications and help providers connect with our resources. As always, we have contact information and these slides will go out after the meeting today. And we're right at 9 a.m. If there are no other questions, Lauren, thank you, Renee, there are some good notes here for you. But if there are no other questions, I'll let everyone go for the morning. Thank you for coming.
Thank you.